Hi, you guys. Welcome back for our daily practice questions. As always, I like to get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, 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 you guys. I'm Dr. Brittany Weinstock. I am a family nurse practitioner, and I'm the founder and CEO of the Nursing Studio. I provide you guys with resources, tools, review videos, review courses, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners with exam success, and I would love to assist you as well. Now, I always like to give you the reminder and disclaimer that we know there's no absolutes in medicine. We treat it on a patient by patient basis, and any of the questions that you see here, I have created and designed based on the current guidelines that are being tested on the ANCC as well as AAMP exam. Now, any videos that you may see that I do, if I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into our questions for today. Question number one states the nurse practitioner is reviewing the patient's medical history and notes he has a history of diabetes, hypertension, and hyperlipidemia. What is the best diagnosis for this? Is it A, metabolic syndrome, B, triad, C, no diagnosis associated with these diagnoses, or D, the diabetic trinity? Take a moment and tell me what you got in the comments, you guys. All right. I always recommend reading the stem of the question first because it allows you to slow down to ensure you're answering what is even being asked of you. So, here the stem of the question states, what is the best diagnosis for this? And when we see a question on diagnoses, I always say run it back and see what the assessment findings are first, right? But here, the nurse practitioner is just reviewing the patient's medical history. And when you see a history of diabetes, hypertension, hyperlipidemia, I want you to think like this: elevated blood glucose, elevated blood pressure, elevated cholesterol. Now, this should put you in the mind of metabolic syndrome. The answer is A, metabolic syndrome, because that is anytime that you have three of the four criteria: elevated blood glucose, elevated blood pressure, elevated cholesterol levels, elevated BMI being obesity, right? And the reason that this is significant because if you have three out of the four of these things, this increases the patient's risk for heart disease, right? So you want to pay attention to these things. So again, the answer is A, metabolic syndrome. Question number two, the nurse practitioner has recently diagnosed the patient with type 2 diabetes. What is the first line therapy? Is it A, Lantus, B, Novolog, C, metformin, or D, glipizide? Take a moment and tell me what you got in the comments. So, stem of the question here states, what is first line therapy? So, they're asking for the first line therapy for a newly diagnosed type 2 diabetic. And you should instantly think C, metformin, also known as glucophage, okay? And then lastly, question number three for today, the nurse practitioner and MP student are discussing the goal A1C for patients diagnosed with type 2 diabetes. What is the best response? Is it A, an A1C of 6.5, B, an A1C of 5.0, C, an A1C of 6.0, or D, an A1C of 7.0? Take a moment and tell me what you got in the comments, you guys. All right, and the stem of the question here states, what is the best response? So, what are we responding to? We are responding because the nurse practitioner and MP student are discussing the goal range of A1C for patients diagnosed with type 2 diabetes. And the answer here is D, an A1C of 7. And now you're probably like, what? Wait a minute, Brittany. But pay attention to what the question is asking you. It is saying, what is the goal for a patient who is already diagnosed with type 2 diabetes? And this is important, and this is why I like to incorporate questions like this. Yes, we know a A1C of 6, 5, 6.5, those are excellent, right? But when the person already has a diagnosis of diabetes, the goal that we're trying to keep them less than is a 7. We already know you're diabetic. So our goal is to try to keep you less than 7.0, okay? That is based on the current guidelines. So D is your best answer. All right, this was a short and sweet one this time. But as always, I hope you found this helpful. Make sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all make sure you meet me back here. Y'all, if you don't want to miss the videos, make sure you subscribe. It is free. And if you're looking for additional weekly videos, check out our membership options. It is $9.99 a month, and we do extra videos with the first one that started on last week. We would love to have you. Also, if you need any of the resources that I offer, feel free to reach out to the nursing studio at 803 400 6864. You can also shoot an email to this. You can also shoot a text message to this number and email us at the nursing studio, the number one at gmail.com. We haven't advanced to emailing on the to that phone number yet, right? But yeah, feel free to reach out. Few things that I offer. My review book is in an ebook option as well as paperback. Those are both linked in the bio of this channel. Also, if you are looking to do something independently, we have a self-paced on-demand review that is broken down by systems. You can watch the videos multiple times, many quizzes associated with it for family and adult general, and it's designed for the ANCC as well as AAMP, as it includes a non-clinical section as well. That's also linked in the bio of this channel. We just finished up our fifth week of the 5-week review. We're headed into the individual sessions that I like to do. So be on the lookout on our up and coming 5-week group course. And then lastly, our one-on-one sessions. I always say just reach out to us, you guys, because it is based strictly on each individual, and let's gauge what you need. But the options that I do offer for one-on-one, you can book sessions for your weaknesses to make them strengths. You can book an exam readiness assessment, or lastly, you can book the custom package, which is the most popular, where I provide you with a pretest. I gauge your weakness based on the duration of time that you're trying to allot to your studying. I formulate and structure a study plan, work alongside with you during the period of that time, and we take you to a successful exam score. So if you need any of these resources, feel free to reach out to us, but make sure you meet us back here. Happy studying. Bye, y'all.